Assalamualaikum. Hello guys, I'm Dewi. This is my first video on YouTube. I will discuss about self-diagnose regarding mental health. But before that, don't forget to like and subscribe this channel. Just go to the discussion and enjoy the video. Alright, the issue of mental health has been widely discussed again. On the one hand, this is a progress that people are starting to show their concern with health and mental disorder and care about people who are survivors. But unfortunately, there is also a trend to feel that you have a mental disorder without consulting a psychiatrist or psychologist. The act of believing that one has a disorder or disease is known as self-diagnose. When we feel something is wrong with our body and feel unusual symptoms, for example, you feel very sad and not in the mood to do anything, you search the internet for your symptoms, and after you read it, you find data that one of the symptoms you feel is depression, and you immediately diagnose that you is depressed, even though you don't necessarily have the disease. It is not wrong to look for information from the internet, but do not immediately diagnose it. Maybe you just feel sadness because of a certain problem, not depression. Remember that sadness and depression are different. Sadness is normal, but depression is abnormal. A medical professional must examine the symptoms, complaints, medical history, and other factors felt by the patient. Then they can diagnose what disease you have. Even after diagnosing, you may need to carry out further examination because suspicion of a disease cannot be concluded just like that. Whereas when you diagnose yourself, you only conclude a problem based on information you have. Then, is self-diagnosis dangerous? The answer is yes. Why? First, because the diagnosis you did might not be right. As a result, you don't get the right treatment. Many people are afraid to consult a psychiatrist or psychologist because they think that people who consult a psychiatrist or psychologist tend to be called crazy or have a mental disorder. In fact, consulting a psychiatrist or psychologist doesn't mean you are crazy, but you can also consult about your problem with your partner, family, and even academic problems. The second danger is the risk of mishandling the way you handle distractions, which you may not actually experience. For example, you are at risk of taking illegal drugs. These drugs, apart from being illegal, may also cause side effects, drug interactions, error in how to take them, and even wrong doses. One type of drug may be safe for your colleagues to take, but that doesn't necessarily apply to you. Do not take the drug without a doctor's instructions. According to experts, mental disorder will not help you to recover. On the contrary, this action risks worsening your mental conditions. The third danger of self-diagnosis is when you talk about your diagnosis to others. Imagine, for example, if you diagnosed yourself with depression, bipolar, or schizophrenia, and you talk to people who actually suffer from the disorders. I suffer from depression. I feel so tired. I feel like I want to kill myself. The words you speak will hurt the hearts of those who are truly depressed. It could be that people who suffer even think of ending their life. Then, for example, you say, I suffer from bipolar, but after trying to be more grateful with life, I feel recovered. The fact is that people who suffer from mental health disorders cannot recover just by being grateful. Maybe it can be better, but it can be cured. Because to be able to recover must go through medical treatment and takes a long time. Basically, humans cannot be objective, so we cannot diagnose and assess ourselves. If you suspect that you have a disease, it is better to immediately consult to a medical person so that you can get the right treatment and not be misdiagnosed. Alright friend, I hope our mental condition is fine even though there are many assignments and problems in our life. Just kidding. Thank you for watching this video and Assalamualaikum warahmatullahi wabarakatuh.